topics, not science, but more of something from an administrative point of view. So we have gone through all the symptom control, communication ethics, all those things. But now, if some of us want to start a palliative care unit, how are we going to do it? What would be the components that is necessary to start a palliative care unit? So this is very important, especially for those who haven't seen a palliative care unit or how it's functioning. So uh, today's topic will be handled by Mr. Binod Hariharan. Uh, basically, he's an engineer, but he's working. He's a trustee of Pallium India, and he has been involved in palliative care for a long time with Pallium India, and he's also working as MD of two companies. He will be able to guide you how to start a palliative care unit and how what would be the main components of that. So welcome, Binod, and it's over to you.
Thanks, Dr. Sunil. Thanks for that introduction, and good afternoon, good evening, and probably for some it might even be good morning. Anyway, happy to be here, and um, as Dr. Sunil mentioned, this is a slightly different topic from what you're used to. I mean, what you've been used to in this, the series of sessions that you've had related to palliative care. In the sense, we are not going to dwell deep into the patient care aspects of it, but more in terms of how do you go about organizing something in your institution or setting up something on your own. Can I share my screen, Raju?
Yes, sir, you can share.
Binod, before you present, we have sent the PowerPoint presentation. We have shared it in the group. So I think some of the participants might have gone through the PowerPoint.
Yes.
Okay.
Yes, thanks. Yeah, thanks for the heads up, Sunil. Yeah, that would be, that is quite useful because, we would probably have more of discussions rather than going through the whole presentation slide by slide. But still, I'll just give a broad overview and maybe take you through some of the slides. Maybe some of the slides are require some explanation about the background, why it is put there and things like that. So I'll just probably spend a little bit more time on those slides, and then I would expect you to, all of you to come forward with your queries, or let's make it as interactive as possible within the limitations. Okay. So I was coming back to the why we need to understand a bit more about organizing. Now, what we have seen over the past few years, when when we have students or even trainees coming in, wanting to learn more about palliative care, they spend a lot of time. Sometimes, if it is a physical, what you call the other regular program, the certificate program that we have in our institution, people spend around 6 weeks full time, and that's a pretty long period to be spending on something, unless you really want to do something in that domain, you want to put it to practice. Now, therein lies the challenge, because once you're aware of the principles, once you're aware of treat a patient, how to take care of his symptoms, his other psychosocial, spiritual issues. the big question that all of us professionals who are normally trained to operate under an optimal condition, I would say. Like for example, if you are a doctor, you expect a basic infrastructure to be made available to you, like a consulting room, maybe a procedure room in case you need to, do some procedures on your patient, maybe even a counseling room, some administrative, staff to be available to you so that they can coordinate the activities. Um, and if you're in a specialty hospital, a multi-specialty hospital, of course you have all these equipment for diagnosis, labs, and whatnot. So as a doctor, you probably expect those things to be already available there, and then your focus is on making sure that the patient or the family in front of you is able to get the right kind of care from your institution, making those resources that are available to you. Now, when it comes to something like palliative care, which is um, I wouldn't say not known to this community, but fairly nascent, if you look at it that way. Even when you talk to a doctor or even a specialist, and you talk about palliative care, most often you find that there are question marks around. So what is it about? Sometimes it may even be, what do you mean by palliative care? That is also something which often we come across, right? Um, so, or even sometimes, it may be like, so what is the big deal about palliative care? After all, you're only providing what you call some relief, talking to them, spending time with them, understanding their story. What is the big deal? I mean, ultimately, we are supposed to cure a patient, take care of his disease. So that is the focus is still there, right? So it's when you are in an environment when the people around you, the institution, doesn't understand the relevance, the community itself doesn't quite understand the real implications or the relevance of palliative care, it becomes very difficult for a person to actually go out there and practice what you learn in these sessions. So that is the whole idea, how do you put it to practice? What are the obstacles that you may face? I would put it as challenges going forward. So different, if you're coming from different countries, the challenges may be different. Even within a country, in different states, the challenges will be different. If you are trying to operate something on your own, the challenges are quite different from when you're trying to set up a palliative care unit within a hospital, which is already functional. So that's the whole idea about, that is what we want to explore in this session. So let's just dive in, and I hope you can see the screen. So Raju, I hope it is visible.
Yes, sir, it is.
Yeah, okay. Thank you. So these are the topics that we will be briefly covering. Of course, it requires at least 4 to 6 hours. I mean, sorry, 5 to 6 hours if you need to go deeper into all these things. But then that is not the idea. We can, especially since all of you are, I believe most of you have already gone through the slides. We'll not be spending too much time on the slides, as I mentioned, but then we'll try to cover, at least try to understand the relevance of each of these items as we go along. So this is something which, of it, the critical, the most important things that we need to focus on. It's about people with not actually life-threatening. I would rather put it as life-limiting or debilitating illnesses. So that is where the kind of care that we're talking about, the palliative care, becomes more relevant. Now, of course, there could be a question: what if it is a acute illness, where you're going through a treatment regime, and whether palliative care is relevant there? I would tend to believe that it is still relevant, but then it becomes even more relevant when it's about managing a situation, and where a cure is not readily available. So, which again, as we understand it, it's almost 70% of the diseases known to mankind which really don't have a cure. So we're talking about that. It's about offering this kind of care right from the point of diagnosis till death and beyond. Where you consider that becomes relevant when you consider the family as one unit rather than focusing on just the patient. So even if the patient is no longer in the picture, the family still survives, and we need to take care of them as well. So obviously that means that's a very demanding thing, and if we need to provide that kind of care, you need all kinds of specialists to come in. You need um, uh, you know what you call an interdisciplinary approach. And yes, that would involve all kinds of therapists, doctors, nurses, pharmacists, and often we tend to forget that the fact that the family and the caregivers around the patient, and last but not the least, the patient himself, he is also part of the team, because unless you consider him or her as part of the team, most of the things what you're trying to do, I'm sure you'll not be as effective. Maybe you will be able to provide some kind of care, but then we may not be as effective when we have the patient also on board as part of our team. So essentially, we're talking about anyone who can contribute to the well-being, or improving the quality of life of the patient and the family. So the reason why I am talking to you here as a non-medical, or how would I put it? I don't have a background, or I'm not trained in delivering medical care. I don't belong to your domain of health care as the public perceives it. I'm basically trained as an engineer. So what is my business? Why am I talking to, or giving a session on this palliative care to a group of doctors? The reason is, we believe palliative care is everyone's business. It's not just the medical community who is responsible. Health is something which affects the whole humanity. It is a concern for the nation as a whole, the state, the neighborhood, the society in general. So people like me who are not trained to be physicians or nurses, or who are not directly involved in delivering healthcare, we are also part of the system, and only if the medical community is willing to accept that, then only people like me who are willing to provide can I put it as a helping hand, or be part of the solution, we have a role to play. So I must thank you, for letting me in, as accepting me as part of your community when you are trying to deliver palliative care. this this is a very general, what you call, broad classification, I would say. When we are talking about delivering palliative care, it could be from within a hospital, where all kinds of specialties are available, and then you have palliative care also as a specialty. It could be an NGO like Pallium India, which is a standalone this thing. You could be offering inpatient facility and also home care and other services as part of the service offering. Then comes the community-based or the community-led services, which, by the way, Kerala has, has been at the forefront or has gained a lot of attention within the palliative care community across the globe. So what we now know as the Kerala model of palliative care. Essentially, it's about the community being involved. Community-led palliative care. So essentially, we also we are also looking at community-based organizations which are trying to provide palliative care, and so these are the kind of service providers, as we call it. Of course, at a national level, there are tools that have been developed, and we also have broad guidelines on how to set up a palliative care facility. These are all available. I mean, these are extracted from existing what you call documents available on the net. You could go and research more about it. We are not going delving deep into it, but just some of the focus points. One is we are talking about assessment of the total pain as we understand it. Which includes not just the physical, it includes the psychosocial and spiritual pain as well. So you look at the patient as a whole and address his or her needs, not just the patient, of course, plus the family. And of course, the documentation, all those things are as important, or if not, even more than the typical this thing. So, and then of course, if you need to address some of these issues like pain, you need to have access to opioids. There should be availability of opioids in your facility, which by the way, even though India is considered as one of the top, or rather the biggest producers of opioids, legal opioids in the world, and we export it to the rest of the world. Still, we see a situation where many of the institutions that we talk about, including the medical colleges, the government, as well as the private, they don't have access to these opioids. Many of them do not stock them, and they don't know how to dispense it. So there is a huge gap there. So whatever you learn, about pain care using opioids, when it comes to practice, if that is not available in your healthcare setting, whether it is a hospital or your individual, this thing, or wherever it is, government, private, whatever, if it is not available, then you're not actually able to deliver effective palliative care, right? So that those kind of things should be addressed. Maybe it takes time, because as we understand it, I believe we have already had a session on covering morphine, its availability, how do you become an RMI, a recognized medical institution, and all those things. So those things should be there. And of course, a team approach is essential, but then you need at least one doctor and one nurse who are trained in palliative care. You can have many other doctors, you can have many other social workers and all that, but this is something which is considered a basic engaging the community and healthcare professionals, which is often forgotten. The focus is always on, like we discussed earlier, the doctors and the nurses, and the community is left behind. So in India, at least as per policy, we are supposed to involve the community, and of course we'll come to that. How that changes a lot of things. Um, yeah. So sorry. So if you are setting up something new, an independent entity, um, maybe an NGO or exclusive palliative care facility, all these things become even more important, because if you are in a hospital, most of the things that we're talking about, there will be a different team which is already taking care of these aspects. But then if you are trying to set up something separate, independent, then these things become even more important, like procuring the required licenses for storing and dispensing medicines, running an IP facility. Of course, then you have a lot of um, uh, you know requirements that need to be met, as far as what you call the standards, the room, the cleanliness, hygiene, all those things which need to be looked into. Plus, of course, disposal of the medical waste, hospital waste, as we generally call it. So those kind of things need to be addressed, which are very, very, very important. Um, and again, it is different. If you it varies from place to place, country to country, state to state. So whatever is applicable in your area, that needs to be understood and then followed. And if you're talking about raising additional funds, and if you're an independent, again, if it is if it is an independent entity, what we're talking about, it is very essential that you have you maintain a separate book of accounts. Money has to be kept separately. It should not be mixed with your personal income or your personal money. Why so? Because anytime a government officer can come in and ask for these details. Where did you get the money from? How did you spend the money? So you are always accountable. You need to maintain the proper accounts and tell them, okay, this is how I got the money from these sources, and this is how I spent. Those kind of things. And if you are looking at foreign money, like there is a lot of discussion now happening around the new change laws that have come into the picture with the FCRA. I'm sure many of you might be aware of this thing. There has been a lot of changes which have been made to the Foreign Contribution Regulation Act. So FCRA it's called. The act has been changed, amended, and which makes it, the norms are different now, which needs to be followed. So you also need to give the proper accounts to the home department, so home ministry, as we call it. Now I'm talking about India in specific, but I know that there are people from outside of India. I'm sure you'll have a different set of rules there. But in India now, if you're getting foreign funds, you need to have your bank accounts in a specific bank. It's very clearly mentioned. You need to have an account with the State Bank of India and not any other bank. And you cannot spend more than a particular amount on administrative, expenses. So those kind of, there will be a whole lot of other, what do you call, norms that need to be followed. So be very, you need to study those things and make sure that you adhere to them so that you don't end up in trouble. And of course, the people whom you are employing, they definitely need those qualifications which are required. Like, for example, if someone is supposed to take care of nursing issues, we know that okay, that person has to be required. Um, so palliative care in India, it started in 1992. In the way we see it now, of course, it started before that in the 80s, but then it was more like, a couple of institutions which were offering palliative care. But then what happened in 92 was, this became kind of a movement, and it started off from a place called Calicut in Kerala. It evolved from, you know, a small team of individuals coming forward to address this pain burden of the community, and which was supported by the medical college authorities. And then it grew, it just grew because of the community's involvement. And this team was also comfortable letting the community step in and support them. So that made a huge difference, especially with the challenges that you see in a developing country like ours. So what works in the developed world may not necessarily work in a developing country, an environment like India, or other such countries which have other challenges. So of course these are typical of countries which belong to this group of developing countries: the population density, poverty, diversity, and all those things. And then lack of training in the medical colleges, no specific policy related to most of these medications and all that, and general lack of interest and awareness. I would put lack of interest could be attributed more to the awareness around the topic. Sorry. So here, things. Sorry. Yeah. So at the macro level, we know that it's the institutions that we are familiar with, which is delivering healthcare, and I'm talking about healthcare in general. I'm not specifically talking about palliative care. But then let us also not forget the fact that at the micro level, it has always been and will be the family. Because if I am down with fever, my family members are the ones who are going to come forward and provide me the primary level of health care. And most often than not, it begins and ends with the family support itself. And sometimes, of course, I need to go to a medical facility or a healthcare facility, in which case, again, the family needs to support me. They need to take me to a hospital. There should be a caregiver with me most often, when you are talking about a hospital admission, especially in a country like ours. So at every point of healthcare delivery, we see the family involvement, and that is very critical. And the most interesting part, um, children talking from the background. Okay, so sorry. Yeah, let me close my windows just a moment. Maybe it's from outside. Okay, hope this is better. So if we focus on the level in between the micro and the macro level, this becomes very interesting. The whole scenario changes, when you talk about the community, or we call it the meso level, the level in between. or the challenges that we see in providing or implementing palliative care services, it disappears. It's all about unlocking this social capital, as we call it. It's out there. It's a treasure box. You know, probably you don't have the key to that treasure box. If you are able to find that key and open this up, I'm sure a lot of the challenges that we talk about will just disappear. Um, so again, one of the things that has made a huge difference in the way palliative care has been practiced in at least this state, what we call the Kerala model. Why it has been so much talked about is the involvement of volunteers, and so I'll just talk about this gentleman called K.N.Nair. He he was serving in the military. He was in the army for quite some time. Retired in '92. Then it was in 2002. His wife was diagnosed with stage 3 cancer now, and she died in 2004. Now, it's not that she was diagnosed. I mean, she was taken to a hospital, or they consulted a oncologist in 2002. That happened at least a few years prior to that, and Mr. Nair was taking his wife to many specialists. He took her to all the major hospitals in the vicinity, but then unfortunately, the diagnosis was not proper. At least as I understand it, she was supposed to undergo a pap smear test, which nobody recommended. And by the time the cancer was diagnosed, it was too late. And that is obviously when typically doctors think about, or at least advise, that palliative care, nothing more can be done, and now you can go to palliative care, which again, it's debatable. I'm sure you have a different view of things now with all the training that you have been undergoing all these over the past few days or weeks. So she died in November 2004. Now, of course, there will be, if you try to put yourself in his shoes, it is traumatic. To get over the grief, it was challenging. But more than that, there are so many other issues which come into play. Like, for example, maybe you could step in and help me out here. Imagine yourself in his shoes, and would you be able to come out and share his thoughts, or how he would have felt? What were the thought processes that he would have gone through? If you could just you could unmute and talk, or you could put it into the chat window also, as you feel comfortable. Anyone?
I feel like he would have been having a lot of mixed feelings. It would have been anger, and it would have been like anger towards even himself, not able to help his wife, and feeling very powerless. Though he retired from army, he could control things, but this is a time where he is not at all able to help out. And then anger towards the system, like what else I could have done, and a feeling of hopelessness, fear, and yeah. So these are some of the things I feel, and yeah, that's all from my end.
Thanks. Yeah, thanks, Vandana. Yes, you are absolutely right. And yeah, Isaac, so that you go through that the process, the 5 stages of grief. Yes, and sorry, but it's very interesting. You feel a lot of anger towards the whole system, the doctors, the hospitals, the community. Um, it's a whole lot of emotions that come into play. So would someone like to add to this? So we talked about anger, go through that denial, um, not able to give much time. Thanks, Chetna. Okay, so what does that mean? What is the feeling? Not able to give much time to wife due to his army duties. Okay, he would have gone through that this thing. I could have spent more time with her while instead of being away from her for such a long time. I could have been here with her, spend more time with her. Yes. Anything else?
Yeah, after
Regret.
that phase of denial, aggression to hostility towards the society, and later acceptance, and what he can do towards himself and toward the community to other people may not suffer in the same way. That thought may had come back. That's the reason you're putting his story down here.
Yeah.
And so how he can make a difference around him and within the community. And once
Fantastic.
acceptance had happened, it only can generate that thought at later stage to find a solace within himself and within the society.
Okay. Brilliant. Thank you. Sorry, may I know your name?
Sandeep.
Sandeep. Oh, thanks, Sandeep. Yes, that was wonderful. Yes. Um, yeah, so there's a lot of frustration and against the system, against the society. You want to take them on, you feel like reacting. And Ricky says frustrated, a feeling of helplessness. Isaac again says something very interesting, pain and guilt. Now, of course, there is this, like Chetna mentioned, not able to give enough time to his wife prior to this. But then, is there anything else which could, lead someone, right? Isaac, would you be able to explain a bit on that guilt part? Isaac, you there?
Yeah, guilt would be there are two portions to the guilt. Like
Mhm.
he feeling himself helpless, and partly if I put my feet in his shoes, see the system has deceived him, and feeling guilty being a army background where everything is perfect, customized, time wise, and which he may not have got into from the community when at the end of stage or during the diagnosis
Mm.
of the illness of her wife, he must have felt a betrayal and the thought, I'm fighting for the country at battlefront at whatever capacity, and I'm not getting that help. That frustration multiplies. But how to overcome that frustration? One can get into the depressive phase or compose himself and to move forward. And it's a challenging task. It's very easy. What I'm saying to now is very difficult to overcome this and try to find a middle path where things can improve. And that would have been the reason. Story of K.N.Nair is here, and he was trying to help the community.
Yeah.
I also think, sir, that he must have also thinking that I should have done something before. Like why, like these many years passed away, and it's now stage 3 where they are telling her to now go away and be in palliative care. What I could have done differently, so that this cancer would have been picked up in a prior stage. and whether something else could have been done to save her, whether I could have tried some other options to save her. So I feel this could be because of I whether I could have done something differently prior, and also when it was diagnosed, something I could have done differently. So a feeling of guilt where he was not able to save his wife.
Absolutely, absolutely. Sorry, your name? I didn't get your name. Sorry.
So Vandana.
Vandana. Okay, thanks, Vandana. Yes, you're absolutely right. So that is that is a feeling that you go through. Could I have done something more? Did I waste a lot of time? I should have taken her to some other place, tried out some other treatment. Maybe I should have taken her to this particular hospital where it was diagnosed. Now that is self-inflicted, but then I also want to share something which he experienced at that point. Now, when it was finally diagnosed, the doctor, the oncologist, who actually diagnosed this disease when it was in an advanced stage, can you just imagine what he would have told Mr. Nair? He or she, the doctor. Now, this is something which we often see happening around us. Now, what he said was, you should have, why didn't you bring her here earlier? Why did you wait so long? Or, you should have brought her here so I could have done something more. Now, that is, it's forced, the guilt that is forced on that person. Now, and like some of you mentioned, that is the experience that a person goes through, and you have the anger towards the system, you are angry at this thing. Some people, um, you know, different people react differently, obviously, and most often this is what leads to some of the reactions that you find commonly, in our system. Like someone goes and sues the hospital. My wife was not diagnosed properly. I had taken her to this particular hospital, and they didn't ask me ask her to undergo the particular test. Now that could be a way of looking at things. Sometimes you just walk into the hospital and then get hold of the doctor, or give him a beating, or it could turn into violence. Um, like some of you mentioned, you could feel totally depressed and go into isolation, consider very negative things also. But then there is the other evolved mind also, right? So where, as far as Mr. Nair was concerned, he decided something else. He decided, what I went through, what my wife went through, this should not happen to someone else. Let me see what I can do for the people around me. How can I contribute and make sure that this does not happen to others? Now, why I told the story is, this is the kind of experiences that most of us have gone through in life at some point or the other. But then some of us decide, okay, this need to change and we need to be part of the solution. And most often we find that a volunteer is born out of such an experience, either direct within his family, himself, or it could be a neighbor or a friend who has gone through this thing, seeing him or her suffer and going through this kind of a situation. So there is always a story behind every volunteer, and that is very important, and that's very personal, and we need to understand that also. That is the reason why I wanted to present Mr. Nair's story. So he finally started working with the local IMA to work with patients, especially cancer patients. And then he came into Pallium India, wanted to contribute. And ultimately what happened was, he took care of an entire team, a home care team, and he became the leader for that team. Now, a leader where a doctor, a nurse, a physiotherapist, all those people were there. But he used to lead the team because he could identify with the patient, the family, their troubles, their needs, and then he was the best person who can their needs. Now, only if the medical community, his team members accept him as part of their team and accept him as a leader, he would have been able to contribute. And did he contribute? He was there 24/7 in our facility. He wouldn't go home. Late at night, he would go home. The next day morning, he would be back. And there was this one instance when he met with an accident and he broke his knee. And when one of our doctors, senior doctors, went to meet him, the first question he asked was, I'm sure most of you would have imagined it by now. It is not about, when am I going to get well or things like that. His question was, when do I get to see my patients? When can I join the team? That was his concern, nothing else. Now, that is a kind of, the background or the kind of emotional passion that many of these, what you mentioned right now, these are the kind of leaders who can make a true difference. Now, so let us move on. So, and he still is a volunteer for us. Okay, now, what is the role of a volunteer? Just like I mentioned now, most often we tend to, underestimate. Like in one of the Hindi movies, they say, never underestimate the power of the common man. Now this is exactly the case. We tend to underestimate. Most often, what you see a volunteer doing especially in a healthcare setting would be running the errands. Like for example, facilitating, maybe transporting a team to a particular place, or if the doctor wants a cup of tea, there is a volunteer who is willing to go fetch him a cup of tea. But we are actually underutilizing a volunteer when we do that. It all depends on his or her capability and the time that he is able to devote for this cause. And if we are able to identify them properly, encourage them, there is no limit to what that volunteer can actually contribute. So it can range from patient care, social support, advocacy, fundraising. Now look at, these are the challenges that you see going forward if you want to set up a palliative care center. So imagine volunteers stepping in and supporting this activity. Of course, you have to let them in and consider them as part of your team. That is very critical. And one more thing which it's very, very important is you have to definitely make them undergo a training program, because often we find that if as we know, there are three things that need to come together if we need to provide the right kind of care. So it's the head, the heart, and the hands, right? So in other words, the knowledge, the skills, and the mind, the heart. Of course, most of the volunteers may have the heart, but then that's not enough. A simple thing like hand hygiene, if it is not the training is not imparted to a volunteer, actually he might end up doing more harm to a patient than actually helping him. The intention is positive. A volunteer goes into a home and then wants to help out that patient, goes and sits with him, caresses his limbs, or gives a shower. But then the basic hand hygiene, if it is not followed, they are a vulnerable group. It's very easy to contract an infection or make things more complicated. So what you say is important, right? The communication skills that you need to have if you are to work effectively as a volunteer. So those kind of things are very, very, very essential. And unless they are trained, they will not be able to, be effective. One plus actually organization and on the team who is there to provide the palliative care. So of course, identifying the areas where that person can contribute and also the time that they are able to spend, because the mind might be there, the will to do it, everything is there, capability is also there. But if I don't have the time, I will not be able to do much, right? So challenges are many. Now it's easier said than done. Now we need to manage volunteers. Everyone would be happy to have volunteers around them, but then that also becomes a problem sometimes if you're not able to manage them properly. So we need to really understand, um, the volunteers as a person, what makes them do it, what they're looking for. Like in this particular case, when we discussed about Mr. Nair, now once we understand why he is interested in joining the team and coming forward to offer palliative care, what is his background? What was the situation that he went through? What is his current psychological situation? What does he want to contribute? Now, these kind of things, if you are able to understand better, then we'll be able to utilize their services better. We'll know what to offer them. And the crucial part, it's always about, what do we all live for? We all want to be happy. We all want to be doing things that we enjoy. And also we all want to feel like we are contributing to the society. Now, one of the things that may give us happiness as human beings would be getting a salary. A high, big pay may also give us some kind of happiness. But in the case of volunteers, unfortunately, the money is not a motivating factor, right? So it is something else what makes them happy. In fact, it may work the other way around. You try offering a monetary compensation to a volunteer who is coming forward to do something, and tomorrow you may not even find him around. He may just disappear because that is not what excites him. So it's very important to know what excites him, what he feels, is a valuable contribution to the team. And if we are able to get them to do that, we can ensure that they are happy and we keep, their contributions will keep on increasing. So again, I must say it varies a lot with the local culture and the individuals. We need to be mindful of that as well. So, yeah, sorry. So definition of collaboration, again, is very simple, straightforward. Why collaborate? Now that is what we need to be more focused on here. So yeah, Chetna says Army officers are very disciplined and know how to manage things in critical times to bring out the best results. Yes, Army officers are good at that. Yes, we can utilize that specific capability in them. But then let us also not forget someone like me who is not an Army officer. I'm an engineer, but I feel I may also be able to contribute in my own way, which is totally different and something which gives me happiness. Like for example, this session, I feel like it's not just I'm helping myself. I would say I feel like I'm contributing to a noble cause. I'm being part of this community which is trying to help the people. Any incentive can be given to volunteers. Yeah. Sorry, Anupam, could you explain that a bit? Any incentive can be given to volunteers.
So you're able to hear me?
Yes, yes.
Yeah, nothing actually. In most of these government programs and all that, like for tuberculosis and other diseases, throughout the 6 months of treatment or 1 year of treatment, the volunteer or the incentive or a community worker is given around 500 to 1000 monthly, and it goes on his account towards the contribution to the society as well as to the patient. A little bit of incentive also will help them, because that is also the need of the this one, so they will be motivated both ways. So I was
Yeah.
just thinking that palliative programs also, if they can introduce something with collaboration with some NGOs or others, to have some incentive given to them.
So, Anupama, thanks for that. But then that is something which needs to be calls for a debate, because you see, as you rightly mentioned, there are programs like the ASHA workers, for example. You remember the ASHA that workers, that how it evolved. Initially, they used to be called ASHA volunteers. They're actually the volunteering was the core this thing. Eventually, what happened was, the government also came forward and tried to incentivize this, offering an incentive for each activity. Like, for example, if you take an infant to the hospital for immunization, you get an incentive. So gradually, what happened was, like maternal health care, or even delivery in an institutional delivery, what you call it. Now, if you get a person to a hospital for delivery, not a patient, I would say a would-be mother, they get an incentive. Now, eventually, what happened was people started coming forward just because of this incentive, and then they eventually became ASHA workers. The moment there is a financial incentive, automatically there is a trend or a tendency to be more focused on that. The results also might be based on that. So that is something which we need to consider. But I agree with you. These are things which are necessary for anyone in the society. But then whether we need to actually give them a compensation in terms of monetary compensation is something which we need to consider very critically, because sometimes we actually lose the essence of it. So yeah. But then there are, if we can incentivize them in other ways, yeah, there are possibilities. Maybe since we are talking about it, I can give you a few examples. There are, you might have seen people very actively involved in social work in your area of operation. Now, at least a few of them move on to a political career, right? Which is a natural evolution, I would say. Now, there is an incentive for him to do the social work, he or she, in fact. So that is being turned into votes at some point. So there is an incentive for a would-be politician to be involved in palliative care or social work, right? So I agree with you that unless there is an incentive, people may not perform at the optimum level. But then the incentive can be different from person to person. That's what, if we can. Yeah, so Dr. Sandeep says financial benefit deviates from the goal from volunteering, rather facilitate them in other way, like recommendation, certificate, etc., job, interview point of volunteering. Yeah. So we need to look at those kind of things also. And Chetna, yes, being an engineer, yeah, I can bring some of my management skills or even some of my technical skills. Actually, I started off as a volunteering my time with my technical skills, fixing computers in a palliative care, what you call a facility. In fact, the first palliative care center in the state, I would say. So that is where I come from. So there are incentives which could be considered, which is not actually monetary. Yeah. Moving on. So sorry. Oh my God. Something went wrong. Yeah. For a common cause, Yeah. Yeah. I'm not going deep into this because it's already there. You must have gone through these things. So it's about working together essentially, and the situation is also changing. So, like we talked about individuals, we should also consider organizations which can come together and work together. Now that is easier said than done. It's very challenging. Like for example, um, if you were to work with a government hospital, for example, it's it's going to be there are going to be a lot many more complicated situations that you need to consider. You may be an NGO working in that space, want to provide palliative care, and you want to provide it to the people who suffer the most, most of whom come to a government facility. But then working with a government institution is not an easy task. So why so? Um, yeah, just before we go there, so essentially the collaborative working ensures that we increase the quality and the coverage of care. Let us also not forget the fact, even after 30 years of palliative care being introduced in this country, um, as per the statistics, only less than 2% of people who need such care have access to that care in India. Now, less than 2% is something we should be ashamed of. Now, how do we overcome this? The governments are challenged. There is always the financial burden on the system. All those things are there. So if we need to provide effective or implement these kind of services effectively, definitely you need to consider working together with other institutions, and that is the only way we can achieve more. Like now, this again, why I put it in was we work with a lot of institutions, NGOs, other CBOs. When I say CBO, it's a community-based organization essentially. um, we also work with government institutions like hospitals, for that matter, the Medical College in Trivandrum. We run an OP every day, half a day, afternoons, from a Monday to Saturday. So there are a lot of people who get access to palliative care just because we are there. But then the government hospital that we're talking about, the medical college, still does not have a stock of morphine, which we need to carry if we need to provide the pain relief. So there are things that we can do, and there are things that the government hospital will be able to provide us with. Like for example, the space, access to the what do you call patients or people in need. So again, just mentioned a story here. Okay, take 2 more minutes on this. Sita came, sorry? Okay. A palliative care patient, now she's the only earning member of the family, and she has her parents to take care of. I think one of them passed away recently. Now the story is that she had a surgery after which she was paralyzed, waist down, and she ended up in a wheelchair. Now, um, initially there was all these interventions which are required, and of course physiotherapy and all those things which we could take care of. Pallium India provided those kind of support, and um, then came the big question: what next? She's partially mobile in the sense, of course, she has got a wheelchair. She can move around in a wheelchair. Her hands are available. She can do something with her hands. She needs to leave, earn something so that she can earn a livelihood. That she can do, and someone comes forward and says that okay, she can probably think of making jewelry, and someone comes forward and teaches her how to do that. And then came the next challenge. It's all right to make jewelry and all that, but ultimately you need to be able to sell it if you need to make money out of it. So how do you do that? So someone comes forward and says, okay, let us teach her how to sell it online. Again, she doesn't have any background in computers. She doesn't have a computer at home or an internet connection. So then we spread the message, spread it to the bigger world, say that, okay, there is this requirement like this. Would someone be able to help this person? And then there was this well-wisher who came forward and said, okay, I can donate a computer. Then came the local internet service provider who pitched in saying that, okay, I'll provide a internet connection. So she didn't have a proper access to her home, in the sense, there was no motorable road in front for house. So the panchayat, the local self-government, they came forward. They made sure that the road was sufficiently widened so that a vehicle could reach her home. The local community members, some of her neighbors, came together and actually converted her house so that she could make some modifications so that she could use her wheelchair in her home. So that made it what you call more accessible. Her house was more accessible for her. And then she started, using the computer, going online, using Facebook, and she started earning money through that means. So the story, why I told the story is there is a lot of people and organizations, entities which came together to make sure that she was back in the society, integrated with the society, and being able to lead a productive, reasonably reasonably good quality of life, and that her dignity was also restored. So if Pallium India were to try and do all this by itself, it would have been simply impossible to do. So it involves the local government, it involves the people, the neighborhood, it involves NGOs working in the space. It also involves the people, friends, relatives who are also interested in contributing and supporting these kind of people. So that is the power of collaboration. Yeah, if you expect self-interest to disappear, I mean, we are all human beings after all, so we have our own selfish needs, and let us not forget that. So that is the biggest, or probably one of the biggest challenges when we try to work in a collaborative environment. So we need to understand that people come from different backgrounds, their needs are different, and still be able to work together, And again, you need a leader. It's all right to have 10 people come together and say that, okay, we can do a lot of work in this area, but then to make sure that there is a common objective, and also people work in sync to achieve that objective, we need more leaders also. So a collaboration, if it has to be really fruitful and effective, you also need leaders. Now the big question is, where do you find the leaders? So do we just wait for the leader to come in and help us out, make sure that I know a lot about palliative care, I'm a doctor, I can help. Now let the leader come and organize everything and I'll go and deliver. Does it happen that way? Unfortunately not. So ultimately we have to realize that there are things that we need to start doing ourselves. It's not enough to gain the knowledge. Of course, you spend so much of time on learning more about palliative care. I'm sure you would like to put it to good use and see the results also, right? So how does it happen though? It always starts off with so Sandeep says, even after 76 years, we can't provide basic primary health care except Kerala, so they can't even think of palliative care. We all need to do our bit at family and community level. Yeah, and be a leader yourself and start. Now, that is very interesting. Thank you, Sandeep. I think it's okay if we deviate a bit also here. That's a good question. So, you're talking about primary health care. What is so different from healthcare? Healthcare and palliative care. What is the basic difference? Now, this is something which someone asked the other day in one of the other sessions. Would someone like to contribute? What is the difference between healthcare and palliative care? Yeah, absolutely. So Sandeep says PHC, primary healthcare. I believe that is what you meant by PHC. It's inclusive of PC. Now that is the whole thing. I think improve quality of life in chronic diseases. Anupama, yes, it becomes even more important. Bijli says ideally there should not be any difference. Absolutely. PC is holistic care. Yeah, Vandana, I think you're right. I mean, there is no difference between healthcare and so what is missing here? Probably this is one chapter in the book of or in healthcare. If you consider it as a book, this was a chapter which was missing, the palliative care component. Now, it's not just in India. It's not just in India, it is across the world. There is this phenomenon is there. Sandeep, let us not feel bad that it is after 76 years we don't have primary health care. Let us also be proud of the fact that there are so many things where we have achieved a lot of good things. And let us also not forget the fact that, Kerala is also a state inside India. And there was a model that was developed which became a model for the entire developing countries. So what is health as per definition? It is again, yeah, that is a very interesting question. It is almost the same as palliative care, I believe. It says it's not merely the absence of disease or infirmity, it is a state of perfect physical, psychological, emotional well-being, right? So that's exactly what we're trying to do with palliative care. So the other day when we were having this discussion, what we concluded was, if you were to implement the principles of palliative care integrated into healthcare, there is no need for palliative care at all. I mean, as a specialty or as a separate department. That is the ideal scenario. But then, is it the ideal scenario always? No. So now we need to have some specialists who can take care of some of the situations if we are facing that. But overall, yeah, healthcare is not merely treating physical symptoms. PC is holistic. Yeah, agreed. So I think we need to move on. We are running out of time. So good. I think these are the kind of discussions which need to happen more. So if we can, so the WHO, the World Health Assembly, also as recent as 2014 came out with this report, or rather suggestion, which was a recommendation to the WHO, saying that the principles of palliative care should be integrated into healthcare. And it asked all member states to look into it and you know do the needful. But of course, the policy remains there. It takes a lot more time, maybe another 50 or 100 years before we even start seeing the changes. So what can we do? We start with I is where it begins, right? And it starts with the process of inquiry, where questions, why, what, where, how, and then that it leads to innovation, in the sense, the challenges that we see, there are innovative solutions also which we could explore. Like, for example, the community-led healthcare or palliative care, which happened here, it was innovation. So nobody thought that the community, the volunteers could actually come in and step in and change, or could actually influence the delivery of palliative care or healthcare for that matter. So that gives a lot of inspiration to others. What happens with that inspiration? It creates a larger impact. Now, it all starts with me, I. So we all need to accept the fact that we need to be the leaders. We cannot wait for that leader to come in. And we all have that leadership in us. Let us not belittle ourselves. We are all leaders, either at home or within among our friend circle. It is just that we need to put it out there. So the individual affects the community, influences the society. And this is what we are trained to do. Now, if you need to work with others, you need to be able to listen to others, understand what their interests are, what they want to achieve, what what gives them maximum satisfaction, and those kind of things. And we'll be able to identify ways and means of working together. So advocacy and fundraising, two areas. I'm not going to go deeper into it, just points that we have mentioned here. The benefits of advocacy, it's very clear. We all know what it can do. If we need to see major change, we need public to be aware. It's not just the general lay person. It also includes the government officers, the politicians. The whole community needs to be aware of the need, and then probably that will start with the change of attitude, and then the policies. It needs to get into the education system, and the kind of impact that it can give to whole project as a whole is phenomenal. And each one of us, again, we need to be the advocates. When you talk about advocacy, it is not something which others need to do. When we spend time with a family or an individual, what we know now, what we have learned about palliative care, that should be shared. We need to probably engage in discussions, conversations, where we can influence at least one person at a time. And once that awareness is spread, it becomes much easier to take the work forward. Healthcare, as we were discussing, if it needs to change, that kind of a movement has to happen. And it also helps in fundraising. I'll give you an example. You might have seen so many people raising funds for children. How many times have you seen people come raise money for the elderly, someone who is, or you can count it in your fingers, we very rarely see someone come out and say that, okay, we need to take care of the dying. It's always about the youngsters, they are the future, we need to take care of their education, all those things. Now, where does it come from? Essentially, it is about lack of awareness. Now, if there is an elderly person suffering in the home, how it can actually affect or, uh, become a problem for the next generation also in that house. How a person who is bedridden, and when you go through that, the suffering, the health related suffering as we call it, the education of the kids gets interrupted, the next generation is also stuck. Now these are bigger issues which we will realize that, if you are able to provide the kind of care that is required for the patient and the family as we advocate in palliative care, things can change for the better. Even the youngsters will be taken care of. Now, and why I mentioned this here is, once people are aware of it, fundraising also becomes easier. Why fundraising? Because most of the things that we talk about will also require funds to come in to be able to implement. Not always, I wouldn't say so. That is something which we need to be clear about. Money is just the means to an end. We need the money to achieve something else. And if we are clear about that, sometimes we can get the work done without actually raising the money. Like, for example, if you need medicines, if there is a local medical shop which is willing to donate those medicines, you don't really need the money, right? You just need them to give you the medicines which are required for this. Or, like, for example, you want to have a infrastructure to conduct an OP, an outpatient clinic. Someone can actually offer a space, maybe 100 square feet of a room where you can provide this service, and that's good enough. You don't have to actually build another a house or a building to take care of this. So most often you find that you don't actually require money. It is about focusing on what is required ultimately, and money helps sometimes to achieve that. Now once we are clear of it, our fundraising strategies also will change. So we will be probably discussing more about the need out there, the need for the patient, the family. And when we have those conversations, we realize that we are on the same side, the donor or the person who is willing to give the money, and we who is, I mean, the people like you and me who are trying to raise the money, we are both on the same side. So it doesn't require a lot of cajoling or convincing. Actually, it is about mostly about storytelling, sharing the experiences, sharing the stories of patients like Sita, who we discussed about earlier. Those are the kind of conversations that can actually happen between a fundraiser and a donor. It's not like, it's not selling it. You're not selling a concept or an idea or an organization statement or anything of that sort. So it's all about touching the emotions. Once you're able to, convey or, share those emotions, people normally tend to open their wallets, or in other words, offer them their help. So um, so we don't really need to ask people to donate. We could actually inspire them to give. And since we are talking about challenges, yeah. um, so so as I said, successful fundraising involves storytelling. And it's not just about sharing success. We could share the challenges, the problems that we face, and and it's about, again, collaborating there. So again, being a good listener helps here. So I think we've reached our time limit. That is what I wanted to share. Any questions? We can take a few questions, and if there are more questions, I'd be happy to answer them offline. We can have another conversation or over the phone or email or whatever suits you. So maybe a few more minutes. Sunil? Yeah.
Yeah, thank you, Binod. So this is a time for you to ask questions, especially for those who are going to start palliative care unit. We may not get such an expert person to talk to you, so please utilize this time.
Chetna, help in any way can be taken. Yes, of course. We all need all kinds of help, right? So give and take. Yeah, absolutely, Chetna. Time is a very critical resource which is hard to come by. So, yeah. Making them feel happy in some way, absolutely. So I should be thanking all of you because I feel very happy being able to do my bit. So if it were not for you, all of you who are uh, patiently listening to what I have to say or contribute towards this session, it would have been, I mean, I wouldn't have enjoyed this whole session, right? So I feel happy. So I'm actually helping myself in a way.
Binod, there is a question. How do you start involving the community?
How do you start involving the community? I think one person at a time, I would say. Um, we can, like they say, think big, act small. So community is essentially a group of people. So the way I would look at it is I can start with conversations with individuals, if not a group. I can start a conversation with my friends. That could be a good beginning. I could have a conversation at home with my parents, with my children. And that could be a beginning. The word spreads. And then not to lose another opportunity. Like, for example, if if I look at it from your perspective, being a doctor, I'm sure you'll be having these IMA meetings or so many meetings. You might be a member of a Rotary group or a club association. Why not start there? Why not start with having conversations? It need not be a talk, it can be actually a discussion. So those are the most effective, I would say, rather than getting 100 people in a room and then talking to them. No, the most effective conversations are always which happen in small groups. Maybe that is the starting point. Social media awareness, absolutely. Today is the world of social media, so yeah, I totally agree. Um, and the kind of impact that they can create, it's phenomenal. Arranging video calls for patients to communicate with their loved ones. Why not? Why not? Simple things which go a long way in helping the patient and their families. Like, for example, in these COVID times, we keep seeing a lot of such examples, right? Someone in the hospital not being able to have their family with them. There are doctors who have helped them have these kind of conversations with their families, especially in certain end of life situations and all that. Absolutely, Anupama. CSR funding is possible. A lot of corporates who are willing to support. The only thing is, we need to be able to understand their language, we need to be able to communicate in their language. Now, corporates have a different language. I'm not talking about English. Sometimes you might have faced this when you are trying to talk to your management, in your hospital. We always end up in a situation where we are not able to convey what we really want, and what they say is also sometimes or often not digestible, or we are not able to understand what they're trying to say. So if you are able to understand the corporate language, like for example, they'll be talking about the impact of the project, be talking about how many the resource requirement, sustainability of the project, and all those kind of things. Maybe we need to get some help there, because as doctors you may be challenged there, but then if you feel there is a CSR opportunity, definitely should not miss that opportunity, even if it means getting external help. Some of your friends might be able to. Until we embrace our mutual brokenness. Yes.
I'm not sounding to be negative, but I just wanted to ask you, how do you deal with certain people who involve in palliative care as opportunists? Like while I was a rural medical officer, I had to deal with certain people. They register for the palliative care community program, but usually they do not show up, and that hinders the program. So, do you have any experience how to deal with these people and push the program forward?
Um, Absolutely, you're right. May I know your name? Who am I talking to?
Uh,
Sorry,
I'm Anumol. Anumol.
Animal. Animal,
Anu. Anu. Yeah.
very valid points. Yeah. You're right. Everyone may not come with the best of intentions, the positive intentions. There could be the odd case where they may come with ulterior motives, as you call it. Now, how do we identify them? Very difficult. It is very difficult anymore unless we try to spend time with them and try to understand, why they are in it and what they want to do. It becomes difficult. So I can share an experience. Maybe that will give you a hint. So there was this a person who wanted to become a volunteer, who came forward, attended the volunteer training program, registered himself, and then after a month or so, he wanted a identity card, which we normally give to our volunteers. But then we have certain limitations there. What we say is, to be eligible to get an identity card as a volunteer, you need to be working with the organization or be involved in these activities for at least for a period of 1 year. Now, uh, now this person went on hopping onto this thing that I need this thing so that I can do these things. Ultimately, what we realized was, when we went and identified what the actual thing was, he wanted this card so that he wanted to access the hospitals. He wanted easy access to hospitals where he could connect with patients, so that he could find customers for the daily what you call the what you call uh, a facility that he was running, which is normally given on rent for patient and families. Now, so that was the intention, and this is why he wanted the ID card, so that he could walk into any hospital. Because as a palliative care volunteer, as a palliative care volunteer of Pallium India, especially with the brand name it is easy for him. Now, but there is the other side to it. Like for example, like I mentioned earlier, there could be a political aspirant, someone who wants to be in the next election, who would definitely want to connect with these people. Now, it's debatable whether we want to let such people in. As long as, now, this is where I would draw the line. You could draw a line anywhere you please, but then the way I would see it is, as long as this person is not causing harm to the patient and the family. As long as it benefits the patient and family, we are okay with it. Let them come forward, because each one of us will have our own interests, our own selfish needs, and that is okay as long as it's not going to hurt the patient and the family. So how did COVID scenario affect palliative services? Yes, it did affect to a lot of, I mean, in a serious way, I think that is a discussion for another day. But then it has been challenging. We were able to overcome it to some extent in Pallium India, but then there are a lot of service providers who had to just close down shop, who were not able to function at all. So yeah, it's always challenging. Yeah, people may join just to show they are associated with a great NGO. Yes, Chetna, I agree with you. But if they are able to pitch in and help us out in whatever little manner they can, that is okay. Let them have the privilege of being associated. Why not? Now, again, my answer would be make sure that it doesn't affect the interests of the patient and the family, long term and short term, I would say.
So, Binod, for the benefit of this class question, um, so funding usually come to the institution which are already established. But for a beginner, how can funding be attracted?
Okay, maybe I can again cite an example. Um, so even though for the benefit of others, even though I am involved in the activities of Pallium India as a trustee, I stay in a place around 200 kilometers away from our headquarters in Trivandrum. So it's called a place called Cochin. There's a lot of people who you know. Whom I am in touch with, or rather, someone says that, okay, so and so is involved in palliative care. Why don't we talk to him and try to find out if he can help? So then people come to me. And there was this one family, the, the a lady who had both her husband and her son. Husband is in his probably 50s or 60s, who has been identified with Parkinsonism, and then that his situation is gradually deteriorating. At the same time, a couple of years back, there was this the son who was just 19 years old. He met with an accident and he was totally bedridden. Now, this family required a lot of help and support, and I was connected with them through to someone else. Now, the list of things that they require, in the sense, medical help, physiotherapy, it's an endless list. Now, I don't have access to all these funds. Of course, I have connections with Pallium Media, that is fine. But then the route which we took was involving the community. Essentially, what I did was I introduced this family to many of my friends' groups, like, for example, the local Rotary Club. There was a chance where I could present, do a presentation of half an hour, where I talked about this patient and family, and they were willing to come forward and support them. So it's all small, or it's in bits and pieces, but it adds up. Like, there was another NGO which came forward and started supporting the food requirements, because the lady was not able to go for work because she had to take care of her husband and the son. So then they were taking care of the food kit. Then there were quite a few people who were willing to pay for the medicines on a monthly basis. So it's all 2,500, 3,000 rupees on a monthly basis, which was supported by individuals. And then there was recently, again, another group has come forward to see if they can take care of the loan which she had taken to take care of the medical, the surgery and other requirements earlier on. It was around 4 lakhs, which is still not paid. And then they were willing to pull in the money and close that loan so that they can keep their house and the small space for themselves. Otherwise they would be homeless. Now, the way I would see it is, fundraising, again, it can be a collective effort. You just need to start the storytelling. The story which I narrated to you, this is an actual life situation, actual people, live people involved. Now people relate to that. People can see the suffering. They want to help. So individual by individual, there could be groups coming in, but then that is the essence of fundraising. Now, once in a while, you also get the big names who are also willing to associate. But then if you wait for that to happen, it may not be easy. So individuals also can do the fundraising. Brands, the organizations which have their brand name known can also do it at a different scale.
Okay, thank you, Binod. I think we have exceeded our time, but this was a very useful session. I think that will be safe. Thank you for making us aware about the importance of statutory requirements, advocacy, fundraising, the importance of community. So thank you for your wonderful session, and thank you all for your active participation, and we'll see you on next Wednesday.
Thank you very much. Thank you for your patient listening. I really enjoyed the session. Thank you for making it so interactive. Your questions were very, very relevant. I just hope that we had more time to spend. It would have been wonderful. Thank you, Dr. Sunil and Raju, for making this happen. Thank you for inviting me.
Thank you, sir, for this wonderful session. So we can see you next Wednesday with a topic on end of life care taken by Dr. M.R. Raju. Thank you all. We'll see you next Wednesday. Bye.